A frightening scene in Cincinnati last night. A Buffalo Bills player collapsed on the field during Monday's game with the Bengals. The incident prompted that game to be postponed.
Yeah, we're talking about Buffalo Bills defensive back Damar Hamlin. He had just made a tackle on Bengals wide receiver T. Higgins, who hit him in the chest during that tackle. But then Hamlin got up, took 2 steps, and immediately collapsed down onto the field. The game eventually, as Erica said, was postponed because the players were by far too distraught to continue playing. They knew this was immediately a life or death situation, which is also why we're not going to show you the video of Hamlin collapsing out of respect for his loved ones. But ESPN broadcast reports that medical officials administered CPR to Hamlin for about 9 to 10 minutes. And eventually, according to some reports, they even used a defibrillator to restore a normal heart rhythm, which they did do. All reports are that he had his vital signs back by the time he was loaded into an ambulance to take him and his mother out of the stadium to a hospital. And that's what the Bills said overnight in a statement, that he suffered a cardiac arrest, but that his heartbeat was restored. Right now, he's at the UC Medical Center in Cincinnati, where he is sedated and still in critical condition. It is just something we do not see often, but we have seen before. The question is just how similar is it? What really happened? So joining us to talk about that, and more importantly, to answer some questions, is the Chief of Cardiology at St. Francis Hospital, Dr. Richard Soucier.
Yeah, Dr. Soucier, thanks so much for being with us. Really, there's never a good time or a place for a sudden cardiac arrest. That being said, there seems like he was in a good place in the middle of the football field. There was a lot of help standing by to immediately help Hamlin. But there are some questions as to why they didn't get him into an ambulance sooner. Is that standard? Sort of walk us through what happens when someone does go through cardiac arrest in a very public place like that.
Yeah, good morning to you both. So thank you for having me. What a tragic situation. And again, I think the most important thing when something like this happens, if a young athlete has a cardiac arrest, or really anybody has a cardiac arrest, the most significant thing is time. And restoring a normal cardiac rhythm is really first and foremost. Once bystander CPR is performed, getting the patient back to a normal rhythm as quickly as possible is the priority. The reason why that is because the longer the patient stays in an abnormal rhythm, the less blood flow they get to their vital organs, their brain and their muscles and all of that. And so the more likely permanent damage occurs. And I remember a long time ago in medical school, I learned the 10% per minute rule. Basically, each minute, the likelihood of a bad outcome increases by about 10%. So getting to somebody within the first few seconds or a minute is really important, for their long-term survival and prognosis from something like this.
Just to be clear, that 10% rule, does that get suspended so long as competent CPR is being administered, like was the case with Hamlin?
Yeah, so absolutely. The most important thing is initiating CPR right up front. So that 10% is based on how quickly competent CPR is performed. So again, the younger you are, the better your outcome is. But by far, the most important thing is how quickly a skilled CPR professional or someone who knows CPR well gets to you and starts the resuscitation process.
So the next big question we have to answer is why this happened. We've seen athletes collapse in the past. Sometimes we find out after the fact that they had a heart abnormality, but sometimes our understanding is that it can happen even if there is no heart abnormality. Can you talk to us a little bit about that?
Sure. Well, clearly this is not my patient, and I'm just guessing at this. But based on the scenario that happened and the fact that it was related to an impact, the most likely scenario is something called commotio cardis, which basically means that the impact happened at the exact wrong place, at the exact wrong millisecond, that just happened to convert his heart rhythm from a normal rhythm into this abnormal rhythm that comes from the bottom chamber of the heart called ventricular fibrillation. And again, when the heart fibrillates, it starts to, rather than pump, it starts to quiver. It decreases the amount of blood to almost nothing that comes out of the heart during each cycle. And that leads to the catastrophic events that, happened last night.
And that has happened before. A former Hartford Whaler player, Chris Pronger, took a slap shot to the chest. I believe it was 1998. His heart stopped briefly because of that. Granted, he did not need 9 minutes of CPR, but this has happened before. He survived, played 12 more seasons. We are certainly hoping the best for Mr. Hamlin. Thank you so much, Doctor, for taking the time to join us and just give us a little bit of insight as to what you saw with your expert eye. We do appreciate that.
Thanks so much.
My pleasure. Thanks for the opportunity.